Good morning, everyone. This is Helen Kornman. We are very pleased to welcome you to the second in a series of 3 webinars focused on capacity development. This series is being sponsored by JSI Capacity Development Center. The first webinar focused on capacity development and the interaction between organizational capacity assessment, OCA and tool and technical capacity assessment TOCA tools. Today, Mounia Msefer, JSI Senior Capacity Development Advisor, and Deirdre Rogers, JSI Senior Consultant, will discuss the topic of developing capacity through grant programs. Historically, grant programs have focused on technical implementation with support limited to ensuring that deliverables are met. Technical, financial, and reporting systems are set up to respond to project needs and are not often linked with the grantee's existing organizational systems. Yet experience shows that a holistic perspective is essential to sustaining impact. This webinar will identify how grants can be leveraged to deliberately build in support to strengthen organizations and discuss lessons learned from a number of JSI grantee programs. This webinar will be taped and questions will be taken at the end of the discussion through the chat function on the left-hand side of your screen. You are all on mute, and we ask that you use the chat function to ask your questions at the end of the webinar. I will now turn it over to Mounia and Deirdre to carry on with the webinar. Please, if you are on the webinar now, if you could mute your function on the webinar. Thank you.
Thank you, Helen. As Helen said, the first webinar in this series on capacity development was on the importance of building a strong organizational foundation in order to ensure long-term programmatic success and sustainability. Some projects, such as the JSI-led CDC-funded TA-NPI and the USAID-funded NUPETA projects, were specifically funded to help build the organizational capacity of local NGOs. But more often, the projects are funded. Oh, please mute microphones. Okay, more often, our projects are funded to achieve specific technical results. For example, improved access or utilization of services, or to scale up a specific intervention leading to improved health outcomes. They are not typically intended to build local organizational capacity. And as Helen said, this is reflected in the way grant programs are managed. Technical, financial, and reporting systems are often set up to respond to project needs and not linked with the grantee's existing organizational systems, and thus do nothing to improve efficiency and build sustainable capacity. So today, we'll briefly share experiences from 4 of JSI's projects, each with a granting component. We'll summarize some key lessons learned and share some ideas for how grants can be approached to improve organizational capacity and ultimately to increase the quality, effectiveness, and sustainability of program impact.
But first, what do we mean when we say grantee capacity development? We are, in fact, talking about 3 different levels of capacity. The first level is the individual level, and these are activities such as training that are designed to build individual staff skills and knowledge in specific technical areas. These activities aim to match skills with job requirements, thus improving staff performance. The second level is the systems level. This includes targeted capacity development interventions aimed at strengthening systems and processes within the organization. And this includes systems such as human resources, financial, M&E, and so on. These systems are the foundations for an effective and efficient organization, and the reliability of these systems is essential. Staff performance will not improve if the systems are not there to support their individual work. The third level, and the broadest, is the organizational level, and this is arguably the most critical aspect in capacity development. and it requires approaching the various CD activities in a holistic way to ensure that all the interventions contribute to the overall mission, vision, and strategic plan of the organization. So you can train individuals to improve their specific skills and knowledge, and you can enhance the systems, but those individuals and systems need to be integrated and related to other systems within the larger organization. For example, you do not want to focus just on the M&E system without viewing it also in the context of the larger organizational needs and goals. This holistic approach improves the organization's ability to adapt and evolve over time. And this principle seems to be widely accepted. I think most would agree that we need to take a holistic approach. But how do we do this in practice, especially on projects that are not specifically funded as capacity development projects? Today, we are going to provide 4 examples of very different projects. JSI's NPI projects were full technical assistance organizational capacity development projects intended to strengthen the capacity of grantees in all areas: technical, financial, and organizational. On the opposite side, the SHARE project in Zambia had no formal capacity development mandate, but, unlike the other examples, the project granted to very small CBOs and undertook somewhat intensive CD efforts with specific work resulting from working with these types of NGOs. The RBHS project in Liberia had 5 performance-based contracts with local and international NGOs. And though there was no explicit mandate to do capacity development of the grantees or contractors, it happened nonetheless, in part due to the performance-based contracting mechanism. And finally, the T-SHIP project in Nigeria was able to leverage existing project resources to strengthen the capacity of its grantees, thanks mainly to its organizational development mandate, which was built into the project during the design stage. As part of PEPFAR, the U.S. government implemented a new partners initiative which provided grants to organizations who had not previously received direct funding from the U.S. government. Under the NPI model, there were 2 parallel tracks. NPI grantees were receiving direct funding from USAID, CDC, and HRSA to implement technical programs. And JSI received funding from CDC and USAID to focus on the capacity development of those grantees. JSI's capacity development interventions follow the trifold approach. We work to increase the technical capacity of grantees to implement quality HIV programs in areas such as prevention, PNTCT, and so on. We looked at areas such as the grantees' program management and M&E systems, their technical reporting process, and we shared state-of-the-art knowledge with them. In parallel, we also focused on strengthening the grantees' financial capacity to manage U.S. government grants. A significant portion of the support was on compliance, and together with the grantees, we looked at their financial systems and reporting, as well as their administrative policies and procedures. Finally, we strengthened the partners' institutional capacity to better position them for future funding from U.S. government sources and other donors. As part of their organizational capacity, we focused on areas such as governance and leadership, strategic planning, human resources, and resource mobilization. The partners' capacity development process started with a baseline organizational capacity assessment, or OCA, and technical capacity assessment, or TCA, both of which resulted in an action plan that guided JSI's capacity development efforts. This model, and like other capacity development initiatives that are typically tied to specific project activities, provided JSI's NPI projects with an opportunity to work with grantees to strengthen their HIV programs, and equally importantly, to step back from day-to-day activities to examine their organization in its entirety. A holistic approach guided the NPI work, where project teams maintained an organizational focus and assisted organizations to build systems, not just for one project, but for the entire organization. Yet, this model had its unique challenge. JSI had no formal relationship with the grantees, and thus had to generate the demand for its services by creating a relationship based on mutual trust and respect. Indeed, relationship building was critical for the NPI project.
Okay, so the first example of a project that had a sub-grant component, but unlike the NPI projects, did not have an explicit capacity development mandate with the grantees is the support to the HIV/AIDS response project in Zambia, or the SHARE project. One of SHARE's original 6 objectives was to provide technical support to increase community-based HIV/AIDS response through a sub-grant mechanism to local CBO partners, what they called the Rapid Response Fund. SHARE provided sub-grants to 25 very small CBOs with an average award of around $30,000 US. Baseline OCAs were done, providing the basis for developing a technical assistance plan for each CBO. The baseline OCAs, however, found that none of the CBOs were ready to receive grants due to a number of technical, organizational, and managerial shortcomings, but especially due to a lack of financial systems to be able to effectively manage funds according to U.S. government minimum standards. Thus, SHARE decided to implement 4 to 12 months of pre-award system strengthening based on the OCA findings. And this decision stemmed from the assumption that institutionally weak organizations are not capable of providing good quality service delivery, and poor quality programs and services do not effectively benefit the community and may even do harm. So during the pre-award capacity development period, the project prioritized financial management training to build the skills to properly manage U.S. government funds. They monitored the CBO system improvements, and all the CBOs received their first sub-grants within 4 to 12 months of startup. So training to improve technical competencies and service delivery was provided in tandem with system strengthening, all according to the tailored technical assistance plan for each CBO. Systems development included things such as development of policies, procedures, of developing a leadership manual and training CBOs in strategic planning and in work planning. It also included tools development and training in a number of topics, including data for decision-making and performance improvement, documentation and communication, and also in resource mobilization, which included proposal writing. In terms of outcomes, with time and increasing institutional and technical capacities, CBOs were able to increase the range and coverage of HIV/AIDS services they offered to their beneficiary communities. The project provided technical support to the CBOs in using their newly developed strategic plans and newly developed project proposals for advocacy and resource mobilization purposes. In 2009, the SHARE project invited a number of potential donors to a fair that was designed to help link the CBOs to other donors, and about a year later, in 2010, 22 of the 25 CBOs had 2 or more funding sources, and 24 out of the 25 had developed income-generating activities that were aimed at sustaining the organization in their activities. Finally, SHARE identified a mechanism through which the CBOs could continue to get support at the end of the grants. They linked district-level HIV/AIDS coordinating bodies to the CBOs in their districts in order to provide ongoing organizational support after the end of the SHARE program or after the end of the SHARE-led grants. So the takeaway for SHARE is that SHARE was not mandated to do capacity development for the grantees. However, they were mandated to grant to local CBOs, which had both unique advantages and challenges in working with small CBOs. In order to meet their own project objectives, they had to build the capacity of the grantees so that the grantees were equipped and able to provide quality services. But project management took it a step further and took it upon themselves to prioritize overall viability and sustainability of these organizations, rather than just building the capacity needed to produce the project deliverable. The next example is the Rebuilding Basic Health Services project in Liberia. It's a 6-year project that's ongoing from 2008 to 2014. The project in the first 3 years managed 5 performance-based contracts with local and international NGOs to implement the Ministry of Health Basic Package of Health Services. Unlike SHARE, the RBHS grantees, or contractors in this case, were somewhat more sophisticated local and international organizations. Their ability to implement quality services or to manage funds according to U.S. government guidelines was not a question. But since it was a performance-based contracting mechanism, their payments were tied to the extent to which they met targets against predefined indicators, and thus the RBHS project staff would do routine data verification prior to releasing payments to the NGOs. So there was a heavy reliance on the grantees, or again, the contractors' M&E systems, including a strong emphasis on data quality. So a lot of the capacity development activities were focused directly or indirectly on M&E systems and capacities. So not a formal OCA like what was done with NPI and the SHARE projects, RBHS did do a pre-award assessment following selection of each NGO to get a sense of their organizational capacities. So one commonality across all the projects we're talking about today is that they all began with some form of needs assessment. Though not explicit, there was a capacity development assumption built into the performance-based contracts. Activities included joint supportive supervision with RBHS staff, NGO, and Ministry of Health staff, joint data validation to facilities, and regular communication between the NGOs and RBHS staff. The performance-based contracts were intentionally designed to have ambitious but feasible targets and to be managed rigorously but fairly, and to ensure that contractors were provided with as much capacity support as possible to ensure their success. What this meant was that regular data review and problem-solving meetings, both individually with NGOs and collectively with all partners together, were held, which turned out to be a key element in the success of the performance-based contracts and in building NGO capacity. These meetings helped establish supportive, collegial relationships and open communication to effectively work on capacity development together. Capacities were built in management systems, both financial and in particular M&E systems, documentation, and technically on the performance-based contracting mechanism. Data show that as a direct result of implementing the performance-based contracts, access and quality of health services have improved quite markedly in the RBHS facilities. Skilled deliveries at facilities tripled, IPT2 to prevent malaria in pregnant women doubled to 81%, and so on. There were also marked organizational management improvements. On-time payment of staff salaries increased from, I think it was around 64% to almost 100%, as did timely reporting of facility statistics into Liberia's Health Management Information System, the HMIS system. Of course, many of these outcomes may at least partially be attributable to the performance-based contracting mechanism itself, the sort of the carrot and stick mechanism, including indicators such as timely HMIS reporting and staff salary payment, which were both indicators tied to funding. You know, they were required to do it or they wouldn't get paid. However, an evaluation of the performance-based contracts suggests that the underlying capacity development framework through which the contracts were implemented was at least partially responsible for these outcomes. The evaluation found an impressive level of agreement across the contracted NGOs on how successful the PBCs were, the contracts were in motivating staff, in building the capacity of the NGOs at the central field and facility levels, in organizational management and specifically management of M&E systems, also in increasing staff sense of accountability, creating a data culture within the organizations at all levels, and of course in improving health outcomes. So the big take-home from the RBHS project is the importance of consistently rigorous yet supportive analysis and technical assistance, and combined with regular communication and feedback with the NGOs in ensuring that capacity development successfully takes place.
The final example is the T-SHIP project in Nigeria, and this is a project with a limited capacity development mandate. It stands for Targeted States High Impact Project and is a 5-year program which started in 2009. As part of T-SHIP's sub-objectives to improve policies, programming, and resource allocation, an organizational development indicator was developed. This indicator measured the number of local organizations provided with technical assistance on institutional capacity building to leverage additional resources for reproductive health, family planning, maternal child health information and services. As a result, much of the capacity development work initially focused on resource mobilization. Technical assistance was provided to a large number of project implementing partners before some of them eventually became grantees. Support in the form of resource mobilization trainings, proposal writing workshops, advocacy skills development, was provided to 31 entities from small CBOs to local government entities and larger national NGOs. Afterwards, 29 organizations were awarded grants to implement technical activities in support of T-SHIP's targets and to broaden the project's geographic reach. A pre-award assessment of the organization was done, followed by a more comprehensive OCA to establish a baseline for intervention. The findings from the assessments showed that resource mobilization capacity could not be built in a vacuum. For a sustained impact, the organizations needed strong leadership and governance, effective management systems, including financial, human resources, M&E, and program, as well as a strategic plan. Because T-SHIP already had an OD mandate, with one partner focusing solely on this aspect, it became easier to leverage existing resources for the grantees' capacity development in those areas. So where do you start with grantees, especially when there is no clear capacity development mandate? There are a few lessons learned from our previous grants experience that we would like to share with you today. First, we need to incorporate capacity development at the project design stage. It then becomes much easier to provide that support, as the people, the financial resources, and the expertise is already available internally within the project and can be easily leveraged for the grantees. In our BHS, capacity development was an implicit need in the design of the performance-based contracts and thus remained a key focus throughout the life of the award. T-SHIP had an overall mandate to increase the ability of local government areas to manage health systems and health facilities, and the project was able to use the resources available for this effort to strengthen their grantees system, even though the project did not have a specific mandate to do that. The second lesson learned is that we should take a holistic organizational view. Successful capacity development depends on both overall management and technical capacity of grantee organizations. Indeed, without the management capacity to set direction, plan and implement activities, and manage resources, technical capacity building will have limited impact. We can even argue that limiting CD interventions to a specific area is not effective. T-SHIP's experience shows that an organization cannot be successful at resource mobilization if it does not have a strategic plan to guide its entire work. SHARE's experience shows that institutionally weak organizations cannot provide quality services, which in turn do not benefit the community. We also have to start with a capacity assessment, both organizational and technical, to map out the scope of the capacity development interventions and the priorities. The resulting action plan will provide a roadmap for a more systematic approach to strengthening the capacity of grantees. All 4 JSI projects that we have just talked about started with some sort of baseline assessment. It will not only help you decide on the appropriate interventions, but it will also inform your decision regarding the type of grant instrument. Our BHS used performance-based contracts because the organizations already had reliable and robust systems. SHARE, on the other hand, decided on a pre-award system strengthening period. Without that baseline assessment, it is much easier to fall back to the old ways and just focus on the immediate gaps that appear when managing grantees. And we can't say this enough, but we need to ensure that project activities are integrated across all other grantee programs. And we really need to build upon existing capacity, systems, and relationships. Finally, the NPI model demonstrated the importance of establishing trust and respect in order for capacity development interventions to be effective. Key areas such as leadership and governance are often in need of capacity strengthening, but it can be a bit politically sensitive to start with that. An effective way to build a relationship with the grantee is through what we call easy wins areas, where both partners have a stake in. And there are 2 categories of easy wins. There are those areas that are driven by the grantee and those that are project-driven. Communications and resource mobilization are often of particular interest to the grantee in terms of overall sustainability of the organization. Under NPI, an overwhelming majority of grantees stated that resource mobilization support should have been provided early on in the project. Yet, effective resource mobilization cannot happen without a strong communication strategy. Those two go hand in hand. So if you start with those interventions, it may open the door to addressing larger organizational issues such as strategic planning and governance, as partners start recognizing that resource mobilization is closely tied to those topics. On the other hand, M&E and financial systems are often of particular interest to the implementing project to ensure that the grantees can meet their contractual targets. In addition, implementing partners have a clear mandate to strengthen the grantee in those areas, and no buy-in from the donor is necessary. An effective supportive relationship in financial and M&E systems tailored to the needs and priorities of each grantee may also open the door for broader capacity development interventions. So what do we mean by effective support in finance and M&E? As implementers, we can build in support for our grantees with minimal additional resources in those two areas. And we have identified 5 broad approaches that we can use with grantees. One of our lessons learned is that we need to build upon existing systems. For finance, we are talking about the accounting system, and for M&E, the data management system. However simple or sophisticated, assess what is there and determine whether it fits the needs of the organization, where it currently is and where it wants to go. After reviewing all the existing tools, forms, and procedures, work with the grantees to adapt them to meet the needs of the project and the organization, right at the start of the project. That support can take several forms, from buying the necessary software to providing short-term TA to adapt the existing system and review procedures and manuals. Then you want to assess the staffing structure of the finance and M&E teams. Look at the underlying causes for some inefficiencies within the system. Review staff workload over a fixed period of time and assess the existing staff skills against the needs and discuss potential solutions with the grantee. Finally, communicate on a regular basis. Be proactive. Do not wait until the grantees submit their reports. Have regular financial and data reviews on site and resolve issues together with the grantees. Those visits should not use a checklist or audit approach, but should be done in a collaborative way. For M&E in particular, it is critical that the project run quality assurance checks on grantee data, provide grantees with findings from QA checks, meet with grantees to review the data and work through the discrepancies, and above all, provide copies of the aggregated data back to the grantee. Also, the project should only be asking for data it is going to use, and thus, when that data is used, a copy should be disseminated back to the grantee. And this is another core principle that I think most would agree to, yet it is not always routinely done.
So Mounia just gave some examples of easy wins, activities that we can easily implement with grantees. For the implementing partner, there are a few lessons learned as well and steps that we can take internally. First, management buy-in is at the base of our triangle here. It's critically important to ensuring capacity development is implemented, regardless of whether the project has a specific mandate to build the capacity of grantees or not. The Share Project Management took it upon themselves to prioritize organizational capacity development of the CBOs. Capacity development has to become an organizational philosophy that drives the project. Then, the capacity development approach has to be incorporated at the design stage. RBHS's successes were arguably largely due to the design and management model undertaken by the project, where they institutionalized capacity development into the management of the performance-based contracts. T-SHIP's efforts to strengthen its grantee capacity were supported by an existing organizational development framework within the project. All projects incorporated capacity development into their design, and all projects were ultimately successful in building capacity of their grantees. So the lessons learned is that capacity development needs to be clearly articulated and incorporated, ideally at the project proposal stage, or at least at the stage of developing RFAs for the subgrants. Practically, this means capacity development needs to be budgeted, included in the project logic model, measured via project M&E, and needs to be comprehensive and holistic. Moving up the pyramid, in developing a capacity development approach, flexibility is key. A lot of times we're beholden to our quote-unquote package of interventions. You know, first we do an assessment, then almost regardless of what the assessment says, we start with, say, financial management strengthening, and then M&E, and then resource mobilization, and so on. But often this is not what is most needed for the grantee. However, adapting and tailoring the nature, or even just the order of specific interventions to grantees can be very time-consuming and thus challenging for a project who's just, you know, trying to stay on track and meet their own actual project deliverables. All the more reason that grantee capacity development needs to be built into project design. At the top of the pyramid is bringing in the quote-unquote right people to lead the process, and that is staff who buy in and accept the capacity development approach, who have experience facilitating the assessment process and in gathering, analyzing, and summarizing largely qualitative data. You find many efforts out there currently to try to quantify capacity development efforts with various tools, and JSI's OCAS tools are among them. But the quantification of capacity development is fundamentally meaningless without the qualitative context. Thus, staff managing a grant program must have a solid grasp of qualitative data and methods, and equally of what the capacity development objectives are, including benchmarks and ultimate outcomes. And something that is not explicitly on this slide, but that would fit with the management buy-in at the base of the pyramid, is consistent and open communication with the donor to ensure their buy-in as well. And of course, everything we're saying dovetails perfectly with recent donor priorities, including USAID Forward, etc. So, how do we ensure that capacity development is an organizational philosophy that drives everything we do? Well, we start with the project blueprints, or that is the project logic model. And then, of course, as I said, we budget for it. We budget for capacity development into all of our projects that have a subgrant component. Now, a logic model is a visual way to present one's understanding of the relationships among resources you have to operate your project, the activities you plan to do, and the changes or results you hope to achieve. The logic model links outcomes to project activities and inputs. And I've heard it described before as making the implicit program theory explicit. So usually, if a project has a subgrant mechanism, it's simply listed in a project's logic model as one of the activities or processes that, in combination with other interventions, will contribute to the overall project outputs and outcomes. And that alone tells you something about the program theory or the extent to which the local, that local capacity development is prioritized. Further, if capacity development of the grantees is included as a distinct explicit activity, it's often just to build those specific capacities to ensure that the grantees can deliver on their project-related outcomes, not necessarily related to organizational priorities. And that also tells you something about the implicit program theory. Granting and capacity development of grantees is typically or often a means to an end. It usually a means to achieving the project-specific outcomes. So what this usually translates into is focusing on a single branch, if you will, rather than the entire tree. So focusing on an organization's financial system capacity alone, for example. But if the grantee has significant and fundamental other areas in need of strengthening beyond that financial system, then simply focusing on that one system to ensure your project deliverables are met does nothing to build real local capacity or to sustain project outcomes. So the project logic model serves as a blueprint for shared understanding. Thus, if an organization is really going to change how it approaches capacity development, it must start with formally incorporating these changes into the project logic model or the project design of each and every project with a subgrant component. Here is a very generic logic model. to try to give you a better understanding of what we are proposing in this regard. We are suggesting using the logic model to help change and internalize the way we talk about and conceptualize grantee capacity development on projects. It must be explicitly stated, the guiding principles must be explicitly stated here in the blue box on the left, and they must include tailored capacity development as a guiding principle, flexibility as a guiding principle, and a commitment to leveraging existing assets. It can still, of course, list subgrants as an intervention, because it is, but must explicitly also include capacity development of those subgrants as an associated activity, and then must go further to have explicit short, medium, and long-term capacity development objectives for the subgrantees, in addition to all of their other activities and outcomes in their logic models. Some illustrative examples of short-term outcomes might be new business system or practices. An example of a medium-term outcome for capacity development might be increased number of funders, and long-term example, in addition to what we often have as improved health outcomes, might be improved sustainability of outcomes or increased local ownership. And just as it is important to incorporate capacity development of grantees throughout the framework, one also needs to do it in the project M&E plan by developing M&E indicators to measure organizational capacity development, again, regardless if capacity development of grantees is a formal project mandate or not. Ideally, project M&E should measure the grantee's capacity across some standard accepted domains, and if the project has an explicit capacity development mandate as well, it should also, ideally, measure its own capacity development interventions and activities using these same domains. So these domains include, for example, the relevance of the intervention. Is the project meeting identified needs of the grantee? Is the grantee providing the right services to the right people? Effectiveness of the intervention, are results being achieved? The efficiency in delivering services and increasing reach, or even the use of innovation. Ownership over both the capacity developed as well as the resources to build that capacity, which is related to sustainability, which could be the ability to mobilize resources, whether there's a diversified funding base, and so on. And though very tricky to do, and with really next to no good examples out there of organizations having done it, with any capacity development project, an attempt should be made to correlate organizational capacity gains with outcomes at the community or beneficiary level. And again, evaluation of capacity development is too much to take on in this webinar, but we just wanted to put up the log frame here as an example of a very specific action that a larger external implementing organization such as JSI can do from the headquarters to the project level to start to internalize and better practice what we preach in terms of truly sustainable capacity development.
So in conclusion, we are suggesting a formal shift in how we conceptualize all projects that work with local partners, so that they explicitly include capacity development as a key process, not just individual or systems level capacity development, but overall organizational capacity development. And we argue that for our public health projects to have a real and sustained impact, the onus is on us, implementing partners of these large international projects, and not just in response to donors, to take a broader organizational perspective and to, in fact, practice what we preach and incorporate holistic organizational capacity development activities into all our projects working with local organizations, regardless if there is a specific mandate to do that. This requires an explicit organizational commitment on the part of the larger international implementing partner, plus a strong commitment by the project management and technical staff to ensure that all project-specific tools and systems are linked or integrated into the grantee's existing organizational systems. In fact, we may indeed be talking about a philosophical or cultural paradigm shift for many organizations from the headquarters to project levels. Thank you.
Thank you very much, Mounia and Deirdre, for that very informative presentation. We are now going to take some questions, and as I mentioned in the beginning, please use your chat function, which is on the left-hand side of your screen, and you can type in your questions. We already have a couple questions that have come in. I'm going to read off the questions, and then I'm going to ask Mounia or Deirdre to respond. And we have about 15 to 18 minutes. We'll go a few minutes over because we started a few minutes late. And so we will go a few minutes over. And at the end of the presentation, we're going to give you a little bit of information about our next webinar. So we encourage you to stay on. So our first question is from James Carungo, who asked, you gave a comparison between the mentioned projects when it came to grants management. Which approach worked better? Were there demerits of not including a capacity development at the design stage of the proposal?
Well, I think that typically the way grants programs are managed is that, finance is on the side, grants management is seen as a mostly finance function. It is very much apart from the technical implementation piece. So we do think that incorporating a CD component into the project from the design stage, as we've said before, is really key to ensuring a more holistic approach to the grantee, and that on the project teams, all the various groups, the M&E, the program, and the finance work together to strengthen the capacity of the grantees to manage their technical programs.
And just to add to that, I think out of the 4 examples we gave, the SHARE project in Zambia is probably the one that really didn't have a capacity development mandate in there, because RBHS in Liberia, it was sort of implicit in the performance-based contracts to make it work, they had to be provided the capacity. So using the SHARE project to answer your question about whether there were any sort of demerits or negatives to not having it in the design phase, I'd say yes, I think that there were, because it's a matter of, in SHARE, it worked because of a very specific project management, they prioritized capacity development of the local CBOs. But that meant that they had to reallocate project resources, staff time and other resources, in order to do those 4 to 12 months of pre-award strengthening. And on some projects, that might not be feasible with or without the managerial, emphasis. So I think that, yes, there definitely, the capacity wouldn't be possible without that level of
Great,
of planning.
Thank you. Our next question comes from Baruch Nagash, and he asks, mentors shy away from covering grantees' institutional costs. Do you see covering these costs as worthwhile and necessary, or do they encourage dependency? And I'll just ask one of you to respond because we have a number of questions coming in.
Well, I must say I'm not totally sure what's meant by institutional costs. If you mean things like salaries or actually funding the systems development.
Well, I think that we if they have a grant from us, we actually cover some salaries and some infrastructure costs so that they can implement the project. It's a matter of how we work with them in the areas that we develop their capacity in. And in finance and M&E, we have to work with those staff anyway, and they have to build in some time into the project. So it's just how we approach our work with them that changes.
Yeah, and just, it's a good question. Obviously, we don't have a really good answer to it, and I am thinking of these examples of things like developing tools and systems and forms and printing those forms and the project, subsidizing all that. And in terms of sustainability, it is a good question. Unless that can be sort of covered by the project going forward, it does raise that question. But so there's no good answer to a good question there.
Great, thank you. And Philip Mbungba asks, beyond proposal writing, how can JSI support CSOs to develop and finance innovative social entrepreneurship initiatives for income generation? How open would donors such as USAID be to incorporating this in existing funding mechanisms?
Well, I certainly don't want to speak for USAID. Again, using the SHARE project, I think it was sort of an innovative idea that project had in terms of linking the CBOs at the end of the grants to these local coordinating bodies, which were largely public sector coordinating bodies that managed all the HIV/AIDS funds and projects in their local,
door is closing.
in this case, districts. So I think there might be room for thinking about mechanisms such as that to encourage or foster other innovative social enterprise or other innovative income-generating activities. So, Mounia.
Great. And we have a couple people asked a question that we combined here. David Dobrowski and Warlagandan Kolabolai asked, can you elaborate on budgeting for capacity development? Should partners manage their own budgets, or should this be retained by the project, or does it matter? What are some examples of budget line items for capacity development? LOE seems the obvious, but are there others?
Well, in terms of the budget, I think in proposal budgets, as soon as you have a grant program within the budget, you want to perhaps include some more staff time, obviously, for building the skills of the project teams to deliver those interventions. But there are also other costs, like making sure that there's enough money for the technical assistance visit, to bring in consultants or other short-term staff that can bring the support, making sure that there is enough money for trainings and other activities and structured learning visits between partners. I mean, there are a number of activities that we need to budget for in the budget.
Yeah, I mean, I guess I'd just add, in terms of having the grantees manage them themselves, often financial management is one of the key areas where capacity is being developed, so it's sort of critical to have them manage the budgets directly, with support as needed by the larger project.
Right. And from Nadia Kist, are you able to share capacity development indicators developed or used by these programs or similar?
Yes. However, I have to say it's the measurement of capacity development. It's still sort of a work in progress, and we're sort of doing it now more than on ongoing projects like TSHIP and RBHS than we have in the past. Often, measurement of capacity development has focused on sort of the low-hanging fruit, if you will. It's focused on changes in staff skills and knowledge and behaviors and whatnot, and to some extent systems in place, but it hasn't gone sort of the step further to really look at the so what, has this translated into changes at the beneficiary level? And that's what we're starting to try to do now. So we are, like those domains, which are sort of standard domains, if you will, the relevance, efficiency, effectiveness, sustainability, all that, those are sort of used very widely, but we're trying now to really more consistently apply them across projects that have a capacity development component and assign indicators to them. So happy to share them, but don't get too excited because they're not super formalized. And also, I should say that they have to be, at this stage, they're very tailored to the projects. So the examples that we put up on the slide there were, of having the diversified funding base and so on. Those are sort of the generic ones, but other capacity development indicators are sort of a work in progress.
And I can also say that USAID Forward has some cross-cutting indicators on capacity development that are high-level indicators, and also that PEPFAR is coming out this month with some capacity development indicators that are more programmatic level indicators that will be more at the programmatic level. And then there are capacity development indicators that the CD network has developed that are programmatic indicators also that are available, Nadia, that you can access. So Terry G. asks, are there examples in which JSI also worked to improve the capacity of donors?
Not directly. I mean, I think that's sort of a question for the donors, perhaps, but yeah, I don't think we have much for you.
I think that the only thing that JSI has been involved with the USAID Forward initiatives and has done work in the field with USAID Forward and some of the trainings that USAID Forward has done in the field. And so that has been some of the work with donors that we have done.
Well, and so just to add, certainly we've worked with small foundations and built capacity around M&E and research with this. I'm thinking one in particular who wanted to be a partner throughout the process and really wanted to be intimately involved in working through how to design and measure the outcomes attributable to the project activities. So they were intimately sort of there along the way. So their capacity, I think, was built in terms of sort of research design and evaluation design. But I'm not sure we have many other examples.
So we have another question here that it doesn't say where it's coming from. Do you have any tools to look at that outline the steps to build financial management systems among NGO partners, specifically more info on the tools you used in the Share Zambia program?
I'm sure those tools are available. I personally don't know what they are, but I know that the SHARE project did a lot of system strengthening around the financial systems as well as their other systems, so they probably do have tools. In addition, of course, to the OCA tools, which were applied on a regular basis, which assess the extent to which the financial system and other systems were in place and functioning. So we could follow up on that and find examples and send those.
Great. And Lily Riva asks, you mentioned indicators such as data culture enhanced. How would you measure this? Was this indicator set in advance of the project start? Did you use this indicator with other grantees?
I think that the data culture enhanced, that was in reference to the RBHS project. We did a evaluation after the end of the performance-based contracts, which were 3-year contracts. And so that was not an explicit indicator as it was a finding that we heard across multiple NGOs about what the outcomes were attributable to the RBHS project and the performance-based contracts, where the NGOs basically said that one of the sort of less tangible outcomes was that overall staff were more accountable for their actions. They understood that their actions translated into sort of outcomes to figures on papers, and that basically from the headquarters level down to the facility level, that people were more evidence-based, that they were using data for routine programmatic activities, and thus that their data culture was enhanced. So it wasn't sort of an explicit indicator as it was sort of a qualitative finding of what one of the outcomes was in Liberia.
Great. And Melissa Scherer asks, what is a reasonable period to conduct on-site review and financial risk? Can financial risk be a basis to decline a proposal, or does it have to trigger capacity development?
I think that some financial risk can be a reason to decline a proposal, but I think it depends on the type of organizations that you work at, depends on the project, and you want to look also at that, how much of a financial risk it is. Is it something that you can work on with the grantee once they've received their award, or is this something that you should work on before, like the SHARE project where they implemented a pre-award system strengthening period? So I think it depends on the project.
Yeah. No, absolutely. I mean, the SHARE project, that's exactly why lots of flags were raised when they saw that, in particular, financial systems, in addition to other issues, but in particular, financial systems were not adequate to be able to receive and manage funds. And in fact, all of the local CBOs, their capacity was built to a minimum so that they were able to fund them. But had they not been, they would not have funded all of them. So I absolutely think that a financial system not being adequate is reasons not to fund them if that capacity can't be built in a pre-award period.
Great. And Arison M. asks, sustainability is a huge challenge to most organizations in Africa. How do we build capacity on sustainability?
Well, again, I think my sort of M&E background is coming out here, but I think it's critically important to incorporate it and measure it from the beginning in all of these capacity development projects, and to explicitly define what do we mean by sustainability. Are we talking about their ability to diversify their funding base? Are we talking about the relevance of their interventions? Are we talking about their ability, which all relates to organizational systems, such as their ability to strategic plan, their ability to develop work plans that are reasonable and feasible, their ability to attract and maintain adequate staff to implement activities. So, critically, I think all of this fundamentally relates to sustainability, and sustainability relates to an organization being able to identify and meet and adapt to local needs.
Great. And from David Dobrowski, should grantees be encouraged to get audited and develop an indirect cost rate, or is this a slippery slope?
Well, grantees, some of them actually have to be audited every year. If they get more than $300,000 a year of USAID funds, they do have to go through an audit. And as prime implementers, it is our responsibility to make sure they do that. And I think that's the way, what we're trying to say is that we actually, we have to make sure that they do their audits, but let's work with them before they go through their audit so that they can actually pass this audit. Right. And in general, it's just good practice to have regular audits, even if it's in an internal audit, and with the board reviewing, having an audit committee within the organization to make sure that the organization is sound. So it's always a good practice, and it's sometimes also required by the country law anyway, as an NGO.
And with the selection of capacity development providers, how can we give partners freedom to choose and yet retain assurance of quality?
Say one more time.
With the selection of capacity development providers, how can we give partners freedom to choose and yet retain assurance of quality?
Well, to choose. I guess it sort of from JSI's perspective, it happens on the flip side. It's like we're funded with, for example, a bilateral project in country X, and whether or not we're mandated to have a subgranting component in that, there's a subgranting component in place, and then a local RFA is issued, and then so then the local partners, they can sort of decide to submit a proposal or not. Granted, it might be the only game in town, it might be the only project, so they might not have very much choice in terms of whether or not they're going to apply to, like, for example, a JSI project versus another one. But yes, I'm not sure how else to answer that question. That it's
there's not.
Yeah.
Okay, great. And this is just this will be our last question, and this is a follow-up on the question, and this is from Philip Mangua again. A follow-up on the question about getting audited and possibly developing an indirect cost rate. Can JSI support advocacy with donors to accomplish this?
Well, I think from our NPI work, it was challenging for partners to actually develop an indirect cost rate, because it's a concept that's a bit difficult to grasp. It's a very overseas, and I think we've worked with grantees to develop a cost structure where they can actually direct bill some of their costs. So the whole indirect cost structure is a complicated process, and to get an ICRA with USAID is a process that is time-consuming and takes a really long time. So sometimes may not be worth the effort for those local organizations.
Well, thank you very much to Mounia and Deirdre for sharing your expertise in this area. And we encourage all of you to attend our next webinar, which will be on December 12th at 9 a.m. And the title is Responding to Shifting Demands, a New Generation in Capacity Development. And it will be very interesting because we'll be shifting to the domestic world and talking about U.S.-based services. And in this webinar, JSI Health Services consultants Jeremy Holman and Katie Saul will discuss how policy and programmatic trends in the U.S., as well as improvements in technology, have encouraged this evolution. They will discuss the lessons they have learned in shifting from traditional in-person capacity development services to more technology-supported methods, along with the challenges they have faced along the way. They will talk about how capacity development efforts in the United States have shifted toward using technology-based distance learning methods such as webinars, online courses, communities of practice, learning collaboratives, videos, and other blended learning opportunities in scaling up capacity development to much larger audiences in the U.S., both at a regional and national level. And this is something that we can learn in the international arena and learn from the lessons learned that they have been using in the United States. So we encourage all of you to attend, and thank you for your attention today.
Okay. Thank you.
Thank you.